Do you try distracting yourself mentally just to delay ejaculating during sex? Guys often do that by thinking of their annoying boss, their fantasy football team, or even their grandma. You might not know it or admit it, but you may be suffering from premature ejaculation. My name is Kevin Francis, host of Men Up Malaysia, a men's health podcast which aims to educate men on men's health issues. In this episode, we'll be talking about premature ejaculation. We will cover the incidence of premature ejaculation, the definition, how pornography can have an influence on PE, the impact premature ejaculation has on men, the causes, the link with erectile dysfunction, and most importantly, treatment options. Also, we'll throw in a couple of tips and tricks to help you last longer in bed. I spoke with a friend of mine, Dr. Arunaslaam, consultant urologist from the Department of Urology from Hospital Serdang, to get the facts and also the answers to this problem. So if you're ready, it's time to man up with Dr. Arunaslaam. Welcome back to the show, Dr. Arun.
Kevin, it's always a pleasure. Thank you for having me in another episode of Men's Health to discuss another very important topic.
Wonderful. Just for our viewers, if you don't know, we had Dr. Arun earlier talking about erectile dysfunction, the flaccid truth of erectile dysfunction. So if you want to watch that video, don't forget, I'll put up the link here and also in the description where you can watch it later. But for this episode, we want to cover the causes of premature ejaculation and treatment options. But Dr. Arun, let's just set the table a little bit first. How it's a very interesting topic, I think, because how do you define premature ejaculation when it's time is a bit subjective, right?
It's very, very true. I guess Flash has gotten the wrong sort of publicity because he's the only superhero that's actually been, cursed and pretty much ridiculed and joked about when it comes to premature ejaculation. There are also lots of comics I think you can see with Flash being in the centerfold.
You don't want to be Flash.
Not in this matter, mate. You don't want to be Flash in this matter unless the partner is also like Flash, I guess. So premature ejaculation is actually a symptom complex, right? It's not something that is easy to define. It's poorly understood, often misdiagnosed, mistreated, and the treatment offered also quite limited. So how do you, how quick is quick? And when someone wants to finish fast, does that mean it's premature ejaculation? So the truth really lies in the person itself, the couple itself. So if you have satisfaction, even after maybe 30 seconds of sexual intercourse, you're satisfied, your partner's satisfied, I don't call that premature ejaculation. However, if you've gone on for 15 minutes and you ejaculate and you would want to go on for about 25 minutes, for example, that's premature ejaculation. You're not satisfied. So the definition really varies. However, the International Consultation Sexual Erectile Dysfunction and the Sexual Medicine Society has actually defined PE, or premature ejaculation, as ejaculation that occurs at least about a minute from penetration, vaginal penetration. We call that lifelong or clinically significant, and if it's bothersome, reduction in latency time, often about 3 minutes or less. So this is the official definition. So it's the inability to delay the ejaculation on nearly all vaginal penetrations, and a negative personal consequence as a result when you feel bothersome, when you feel frustrated, and you want to avoid sex and intimacy totally.
Now, research says that 20 to 30% of men worldwide suffer from premature ejaculation. I asked Dr. Arun if this is true.
I just want to show you how the incidence is, and you are rightfully correct when you actually said that 30% of men actually do suffer from it, but it varies depending on their age as well. But what is really alarming is the fact that the young, between 18 and 30, there are 30%. And of course, we expect this to increase with age, but it's pretty static over the years. It is a huge problem, both in America, the USA Health and Social Life survey says that. And this is premature ejaculation attitudes is a paper in 2007 from Europe, and also somewhat similar to almost 30%. You have 22%. Germany has about 24%, Italy about 20%. So all this is sort of mirroring between 20 and 30% of the population having experienced or having this problem.
According to the definition, premature ejaculation happens when a man ejaculates within 1 minute from penetration. But that's not what happens in porn, right? It's much, much longer. So is pornography misleading and denying us that satisfactory outcome?
You'd be surprised, right? That is actually a huge factor that impacts our population, because how do we all start and find out about what intercourse is, how what stimulation is, how to go about with a woman and all? Usually it's because of watching audiovisual with audiovisual aids, right? Pornography.
Yeah.
So in pornography, everything is augmented. Everything is augmented from the parts physically. Patients also have the story. It's a play. It's a movie.
Yeah.
And the problem is a lot of people get carried away and they think that is the norm. And because of that, it becomes a huge psychological factor that is actually innate and built into a person. And that actually is very, very difficult to put away, because you feel that is the norm and that's how you should perform. And a woman should be satisfied in certain ways. And, but it's something that is not real. And I think the most important thing is communication with the partner, and when you're counsel them together.
That's right. So I guess don't judge your performance in bed or compare it with what you see in pornography. This sexual dysfunction is also known by terms like premature climax, early ejaculation, or rapid ejaculation. And PE can cause anxiety and depression in some men. Dr. Arun elaborates on the impact premature ejaculation has on men.
You are very right in saying that this impacts very greatly on the quality of life. It does, because the sexual relationship usually gets affected tremendously when you have an issue. And you won't be relaxed. You will have less frequent intercourse. The tension, there'll be a lot of tension between the partners. And also emotionally, you'll be mentally stressed, anxious, and also there'll be performance anxiety. And that could also relate to a vicious cycle that contributes to PE.
Now, if factors like performance anxiety and stress can play a part in PE, it seems to me like it's more of a psychological issue rather than a physiological one. But Dr. Arun clarifies.
I think there are two components. You definitely have the psychological problem as well, but physiological issues have to be ruled out as well. So as we spoke about erectile dysfunction before, a strong number, so about 30% of people with erectile dysfunction actually have premature ejaculation as well. So if you don't have this anatomical issues sorted out, then you can say it's probably psychological. So that's why the treatment will also include psychological drugs, psychotherapy drugs.
Right, but if we want to overcome premature ejaculation, should we fix the psychological side first or address the physical issues?
A good question. And I feel that it should be tackled in a multimodal way. So there is a psychological impact, and definitely there's a stressful impact as well. But if we don't tackle the physical impact that the patient has, then I think we're not addressing the problem. So genetically, someone can be having an issue. The health status can be poor. They could have prostatic problems that needs to be sorted. And then, the thyroid gland has to be checked. And then previously, they could have some traumatic experience that has to be dealt with. And then, of course, your psychological problems where emotions and, couple counseling and all that has to come in. So you can't just deal with one factor. It's a multimodal way to approach this. And I think it has to be dealt together.
Earlier, Dr. Arun mentioned erectile dysfunction and says there's a link between ED and PE, premature ejaculation.
So the assessment of erectile dysfunction is very important when you're assessing premature ejaculation as well, because as we spoke about how there's an overlap of 30% when you have erectile dysfunction, you could also have premature ejaculation. So there are papers to prove that half of the ED population experiences premature ejaculation, and some papers, it's roughly about 30%. So very importantly, during the management, we will discuss that ED has to be treated first, because when you treat erectile dysfunction, then sometimes they can also have improvement of premature ejaculation as well. So the ED has to be treated first.
So we touched on some causes of premature ejaculation earlier, but now we are going to dive deeper into how premature ejaculation happens, the causes and etiology.
Etiology is what we mentioned before. We spoke about the etiology, but I think the important thing is to relate biological versus physiological causes. Anxiety, penile hypersensitivity, and serotonin, which is actually the very important neurotransmitter for this dysfunction, has to be studied. So these are the important things. And what we really need to know is there are two mechanisms physiologically for the premature ejaculation. One has to understand the physiology of the premature ejaculation well. So the physiology in the body is there is emission and also there is expulsion. So emission is when you have the sperms from the testis during arousal. They actually go to the prostatic area where they actually got seminal fluid, and they remain there until there is a lot of gyrations, and you have the act of ejaculation or expulsion. So anywhere along this line, there could be some issues. And serotonin is actually a neurotransmitter that helps this happen. So when you have too little serotonin, there's a problem. When you have too much serotonin, also there's an issue. So these are the things that actually warrant investigation when a patient comes to you for this problem.
So basically, the main culprit is this serotonin phelela. And when we talk about treatment, we'll be highlighting the medication that can manage serotonin. But before that, here are some causes or risk factors we should know about.
There could be health-related issues. A patient could be obese, diabetic, could be a smoker. They have genetically they're abnormal. They have prostatitis, and that is inflammation of the prostate, because the prostate contributes to the secretions, seminal secretions, and that can cause issues too. If they have a hyperthyroid issue, that can lead to many problems in the body as well, and that could be an issue. And then you get traumatic and also sexual experiences in the past. It can lead to problems with emotions and anxiety.
Before we get into treatment, if you find this conversation helpful, do give us a like and subscribe to our channel, as we'll be covering more topics like these in the near future. And it helps to push this channel to more men out there. Now we are going to talk about treatment options. If you find this information a little heavy, or you want a source for the names of the medication, do check out our website at manupmalaysia.com for the transcript of this podcast. The link will be in the description. Now, Dr. Arun explains how premature ejaculation is diagnosed.
So there are a few things that we can do. We have questionnaires. We have the premature ejaculation profile, the index of premature ejaculation, and premature ejaculation diagnostic tools. So these are all questionnaires that ask you relevant questions in order for you to come up with a score to tell you how bad the PE is. So these are the models that we use to evaluate a patient among the other history taking and clinical examination that we do.
And from the findings, we will begin with first level treatment.
So the treatment options vary. You can divide them into behavioral therapy and also pharmacological treatment. And the key, basically, as we said before, is to identify that the patient has erectile dysfunction or an infection that needs to be treated. So that ED has to be treated first. So psychosexual counseling is of utmost importance. And when I say psychosexual counseling, you have to do it with the partner. the partner is has to come in and be counseled together to find out what the problems they have, and that is really the first step. The stop, start, squeeze technique is something that Masters and Johnson's has used for many, many years. It's gone on for decades, and it actually is one of those mainstay of treatment. So just before, when you're actually aroused, and just before the point of no return, we have to actually stop, squeeze the penis, the head of the penis, and start this technique again afterwards. So basically, you're retraining yourself to basically stop, to delay the ejaculation. And you can do a stop start. I'll show you a diagram here. So this is the stop start technique. So just before the point of no return, we just stop, let the stimulation urge pass, and then we continue the stimulation again. So that's the stop start technique. And of course, there's a squeeze technique as well. Again, stop just before the point of no return, and then exert some firm pressure, and then you can start again. That's the squeeze technique. So it is withdrawing just before the point of no return, and the squeeze technique as to squeeze the penile head just before the point of no return.
If you find the information here interesting and helpful, do give this video a like and share, and also subscribe to our channel for more men's health topics. I really do appreciate that. Now, Dr. Arun goes into medication, so you might want to remember some of the names mentioned here.
The next line of treatment is pharmacotherapy, and pharmacotherapy is serotonin inhibitors, SSRIs, selective serotonin inhibitors. You have topical anesthetic agents that can be applied and used. Certain PD5 inhibitors that are taken that we'll discuss soon, and even tramadol, which is an opioid medication for pain that has actually got some effects in premature ejaculation. Serotonin is actually considered to be the key inhibitory neurotransmitter involved in processing ejaculation. So there are multiple serotonin inhibitors or receptors rather in the hypothalamus, in the brain, and also the spinal cord. So basically, ejaculation is commanded by the spinal ejaculation generator and excitatory inhibitory influence from the brain. So hydroxytryptamine or serotonin is involved in this that we mentioned, with its ejaculation retarding effects likely to be attributed to activation of these receptors, both spinally and supraspinally. It can actually control these receptors. You can control ejaculation as well. One of the selective serotonin reuptake inhibitors is depoxetine. Depoxetine has been proven to be effective in premature ejaculation, and it's also been authorized or licensed in countries for the treatment of premature ejaculation. And I think there's a pharmacotherapeutic profile that you have to discuss with the patient because it's used for an antidepressant. So they come with their own side effects, and that has to be relayed to the patient. It's rapid as you take it, and also the creatinine clearance is pretty good. It's readily available in our market here in Malaysia as well. And of course, the treatment has to be with caution. These are just studies that I put up basically to prove the effects on the patient with premature ejaculation. And a lot of them have got beneficiary effect and satisfaction. So the stress factor is contained, and also the PE improves. There are different types of SSRIs that are available, and depoxetine is quite safely used in our market. As we mentioned, every drug has its own side effects, and some of the side effects that are worthy of mention is fatigue, drowsiness, yawning, nausea, diarrhea, and sometimes dry mouth and vomiting. So there's some patients say that, oh God, I don't feel an orgasm at all, so and ejaculate, a dry ejaculate, a loss of libido sometimes. So these are all SSRI withdrawal syndromes, and it can be stopped if you do not abruptly withdraw the drug. So everything has to be withdrawn if it is withdrawn in a controlled fashion. Even in the withdrawal syndrome, you have dizziness, headache, vomiting, and occasional diarrhea, and some agitation. And some patients have gone as far as depersonalization and also suicidal ideation. So it is actually very important to counsel a patient, and also if you can seek a counselor or get some psychiatric evaluation, that is also recommended.
All right, I'll admit that part is a little heavy with a lot of medical terms, and you can get the information on our website as well. Just head to manupmalaysia.com. Now, for some men, using a condom can also help delay ejaculation. This is something the good doctor recommends.
For certain male patients, condoms are provided in different ways. So a condom can be thicker than what it normally is. And when it's thicker, then the feeling is less sensitive. And therefore, it's also part of a treatment of PE. Lignocaine, prilocaine creams are very good topical agents. They are used about 20-30 minutes before intercourse. You have to read the insert because certain creams need to be washed off, certain can remain there. It also has to be discussed with the partner because the partner can also have desensitization when you use creams like this. And you often use condom to help prevent the partner from actually having it rubbed off on the vaginal wall and causing them to have an orgasm. A lot of aerosol-related formulas are also there now. So instead of just rubbing it on topically, you can actually spray it on as well. It's a bit hard to get in our local setting, but it's available. 5 minutes before sexual intercourse, you just have to do a gentle spray, and the time for latency time actually does increase. It's interesting that tramadol, which is an opioid analgesic agent or painkiller, is actually very important in also managing patients with premature ejaculation. So it's a centrally acting drug, and it also helps in inhibition of the serotonin and noradrenaline receptor uptake. So what it does is the transporter of noradrenaline and also serotonin is just inhibited. And we see from a study here where 50 milligrams of tramadol given to about 272 patients, and there were increase in dose, 100 milligrams of tramadol, also checked in two arms. Basically, both of these patients exhibited benefit in terms of premature ejaculation. And this paper was in 2015. So although there is a recommendation to use it, if it's not a very strong recommendation, it can still be tried. A PDE5 inhibitor, which is what we use for erectile dysfunction, sildenafil, has also got some effects for ED as well, so for pre-E as well. And there was some overall sexual satisfaction and a decrease in refractory time for these patients. So it actually treated not only the erectile dysfunction, but also the premature ejaculation. So couple study is a study that is done for erectile dysfunction. 30% of men, they actually evaluated these men, and they were all randomized into a double-blind placebo-controlled arm where they were given PDE5 inhibitors, where they had a very bad ED, and they were evaluated at 12 weeks. And what it showed was that PE was also better. So this actually proves that these drugs actually help not just one disease, but it helps with both.
Okay, Dr. Arun, thank you so much. Thank you so much for enlightening us about premature ejaculation and also the treatment options that we look forward to for those suffering from PE. Thank you again.
My pleasure. Thank you.
So that's our episode on premature ejaculation. A big thanks to Dr. Arunaslaam, consultant urologist at Hospital Serdang. Dr. Arun also did an episode on erectile dysfunction, and the link will be in the video here. Don't forget to give us a like, share this video, and subscribe to our channel for more men's health topics.